Hello, my name is Kara Browning, and I am here to discuss with you the Women and Lung Cancer Research and Preventive Services Act of 2019. So, lung cancer is the leading cause of cancer death among women. And according to the American Cancer Society, there will be just over 100,000 new cases of lung cancer in women in 2019. Because of the increasing incidence of lung cancer among women, policy needs to be made for additional research to be conducted regarding women and lung cancer. Currently, there's limited research as to why there's an increase in incidence of lung cancer in women. And according to Harvard Health Publishing, the rate of lung cancer deaths in men has decreased since 1990, but has steadily risen for women. So lung cancer has become a women's health issue that needs to be addressed. The Women in Lung Cancer Research and Preventive Services Act of 2019 proposes to address this issue by providing additional research to find the differences in risk factors, response to treatments, and etiology for lung cancer in women. This policy also promotes starting lung cancer preventive services for women. So, lung cancer screening is a powerful and beneficial tool to decrease the mortality rate of lung cancer. And according to the American Cancer Society, approximately 66,020 women will die as a result of lung cancer in 2019. So there's results from the National Lung Screening Trial, which show that with proper lung screening programs in place, there would be a 20% decrease in mortality related to lung cancer. This translates into 13,204 women not dying from lung cancer in 2019 if proper screening programs had been put in place years ago. So this alarming statistic really shows the need for the passing of the bill so that proper screenings are in place to detect lung cancer. The Women in Lung Cancer Research and Preventive Services Act of 2019 also promotes educating the public and creating awareness programs for lung cancer in women. So public awareness and public education programs are extremely beneficial. For example, the CDC shows us about, tells us about how when they started public education awareness programs for adults that were smoking cigarettes, the rate of adults that were smoking cigarettes decreased from 20.9% in 2005 to 16.8% in 2014. And it was largely in part to those public education awareness programs. So if public education and awareness programs were started regarding women and lung cancer, it would be assumed that the mortality rate of women caused by lung cancer would also be significantly lowered. So this proposed bill aims to really start that public education and awareness programs as well. So the big question is, how do you pay for a program like this? What does it cost? So when it comes to the cost of providing lung cancer screenings, I actually came across a study that looks at the cost utility analysis of lung cancer screenings. And in the study, it was found that the projected cost of lung cancer screening and treatment in the base case averaged $1.8 billion per year. This study assumed that low-dose helical computed tomography, or LDCT screenings, would be provided annually over 15 years to high-risk adults from the age of 50 to 64. The findings of the study indicate that repeat annual lung cancer screenings in a high-risk cohort of adults from the ages of 50 to 64 is highly cost-effective when it's compared to other screenings such as pap smears to test for cervical cancer and mammograms to screen for breast cancer. The annual LDCT screening for lung cancer was just as effective. There's also economic benefit in screening for lung cancer. If you reduce the amount of individuals that are dying during their productive years, lung cancer screenings is actually going to increase economic output. So over the 15-year period that the study looked at, if we were stopping these deaths of people that were dying from lung cancer during their productive years, we would actually gain $4.8 billion in wages, $1.7 billion in income taxes were gained, and $10.6 billion in GDP was added. This projection means that for every dollar that's really spent on lung cancer screening, society would actually end up recovering 38 cents from its investment. The cost utility ratios estimated in the study were in line with other accepted cancer screening interventions, and it actually supports the inclusion of annual LDCT screenings for lung cancer in high-risk populations. So essentially what that's saying is that the cost of these lung cancer screenings could essentially pay for itself. As far as the cost for research to find the differences in risk factors, response to treatments, and etiology for lung cancer in women, funding from advocacy and research organizations could provide the much needed support to kind of propel forward the research for lung cancer. According to LungCan, which is a advocacy organization, there are many other organizations that fund peer-reviewed research, such as the American Lung Association, the Lung Cancer Research Foundation, the Lung Cancer Foundation of America, Longevity, and Uniting Against Lung Cancer. So these organizations could potentially be a source for that funding for future research. And another source of funding could be the Prevent Cancer Foundation, which already has been funding grants and fellowships that demonstrate potential for impact on cancer prevention and early detection of cancer. Another source of funding could be the Prevention and Public Health Fund, which was actually established by the Affordable Care Act. The Prevention and Public Health Fund is the nation's first mandatory funding stream dedicated just to improving the public's health. And according to the American Public Health Association, the fund is already being used to support a variety of community prevention and clinical prevention programs. The Affordable Care Act actually authorized $18.75 billion for the fund between the fiscal years of 2010 and 2022. The Public Health Fund is made to improve health outcomes and reduce costs of health care. So according to the U.S. Department of Health and Human Services, the Prevention and Public Health Fund has invested in a broad range of evidence-based activities that support community and clinical prevention initiatives. So this shows that it could also be a potential source of funding for not only the research as to why women are having an increased rate of lung cancer, but also to promote the public awareness and provide education about lung cancer in women. So with the importance of this issue brought to light and the cost of the bill discussed, there's really no reason why the bill shouldn't be passed. Funding is taken care of through these organizations and also through the Prevention and Public Health Fund, and screenings themselves actually will end up paying for themselves in the long run. So the impact that this could have is substantial for women. You would be saving the lives of grandmothers, mothers, daughters, aunts. So really passing this bill is an easy decision with the amount of lives that it could save and the amount of good that it could do. Thank you for your time.